I am Dr. Anil Kumar B.T. I'm a consultant nephrologist and a transplant physician. I'm working at BGS Clinicals Global Hospitals, Bangalore. Today, on the eve of World Kidney Day week, I'm going to talk something about kidneys, the different type of kidney diseases, what are the common symptoms and signs, and how we can prevent these kidney diseases. To start with, first we need to know what are these kidneys, where they are situated in the body. The kidneys are two bean-shaped organs weighing around 150 grams each. They are situated on either side of the spinal vertebra. So their main functions, what are their main functions? The main functions of the kidneys are to remove the waste materials from the body and also to keep the fluids in balance. So these are the main functions of the body. So whatever we eat is metabolized in the body, and the waste materials are produced. What we can measure in the blood is only urea and creatine, but there are a lot of other waste materials in the blood which the kidneys excrete in the form of urine. In addition, they also keep the fluids in balance. How much ever water you drink in a day, but the kidney sees to that the water is optimally balanced in the body. In addition, they have got lot of other functions as well. So one of the function is to produce some hormones called as renin and aldosterone. So their main role is to keep our blood pressure in the optimal level. Kidney also produces a hormone called as erythropoietin. So what it does is it acts on the bone marrow in the bone and it produces red blood cells. So what happens is our hemoglobin is in the optimal level. So whenever the kidneys fail, this hormone production also reduces and patient develops anemia. In addition, the kidney also is a place where the active form of vitamin D is synthesized. So what does this vitamin D does? So it will absorb the calcium and the phosphorus in the intestine, and this calcium and phosphorus are important for keeping our bones healthy. So whenever there is kidney failure, once again, this vitamin D function is affected and the bones becomes weak. So they also play an important role in keeping the electrolyte levels in a balance and also important for keeping the acid-base balance in the body. So having known what are the functions of the kidney disease, we also should know what will happen if the kidneys start failing. So the kidney failure are mainly two types. One is a temporary kidney failure and another is a chronic kidney failure, or we also call as chronic kidney disease. The temporary kidney failure, where we call as acute kidney failure, is a reversible type of failure. Usually it is affected, this is caused because of some infections, because of dehydration, because of obstruction, or if a patient is admitted for some obvious reasons like multi-organ failure in an ICU and he develops an acute kidney failure. So most often these type of kidney failure are reversible and usually they improve by the end of 48 hours to maximum 2 weeks. At the most they may take around 3 to 4 weeks to improve. The other type of kidney problem is called as chronic kidney disease, where the kidneys fail. So this is what is chronic kidney disease. Chronic kidney disease is a clinical condition where there is the GFR, the glomerular filtration rate is less than 60 ml per minute, or there is a structural damage to the kidney and which is persistent for more than 3 months. So basically this chronic kidney disease is a progressive disease and it is an irreversible disease. So it progresses over stages. There are 5 stages of chronic kidney disease, stage 1 to stage 5. Stage 1 means when the GFR is more than 90 ml per minute, means in literal terms when I am telling it is the kidneys are functioning more than 90%. And stage 2, 3, 4, 5 depending on the percentage we categorize it. And stage 5 is a stage where the kidneys are functioning less than 15 ml per minute. Means the kidneys are functioning less than 15%. When it falls less than 5%, we tell it has reached end stage, or we also call as end stage renal disease or end stage kidney disease. This is a stage where a person requires either dialysis or a transplantation to continue his life. So, the kidney failure, chronic kidney disease is a progressive disease, irreversible disease, and it progresses slowly over months to years. It has got 5 stages. Stage 5 is a stage where we also call as end stage kidney disease, and the only two options are dialysis and transplantation. So, whenever the kidney CKD reaches stage 3 and 4, patient develops a lot of complications. So, the common complications are anemia, CKD bone disease, and infections and malnutrition. So, why anemia develops? Because, as I earlier told, one of the main function of the kidney is to produce a hormone called as erythropoietin. Why a person develops a bone disease? Because kidney produces an active vitamin called as vitamin D, which will absorb the calcium and phosphorus from the intestine and keeps our bones healthy. So whenever the kidney fails, this vitamin also is produced in a lesser amount, and in turn, lot of changes happens. The calcium becomes low, then another hormone goes like parathyroid hormone. So all these things will cause a bone disease actually. And lastly, these patients are immunosuppressed. They are prone for infections, and also malnourishment is a common problem. The next is we need to know what is the burden of this chronic kidney disease. Chronic kidney disease is now the fifth leading cause of death in the world, and we should be surprised that 1 out of 10 people will suffer from chronic kidney disease. And why is this chronic kidney disease has increased in number is because the diabetes number is increasing, and by 2030 India is going to be the leading country where diabetes will be the highest number of people in India itself. So 1 out of 10 patients develop chronic kidney disease. So high is the burden of chronic kidney disease. So we need to be aware that who are the persons who are at risk to develop chronic kidney disease. Because if we know who are at risk, we can detect this kidney disease early, and we can try to prevent this kidney disease, because the burden of this chronic kidney disease when they reach end stage renal disease is humongous, especially in a developing country like India. Because when they reach end stage renal disease, that is a stage where they have to get either dialysis or transplantation to sustain life. In India, what happens is out of 100 patients, if they reach ESRD, only 10 to 15% of them can afford to get a dialysis done or a transplantation done. So the majority of them die because of complications of chronic kidney disease. So it is important for us healthcare givers to detect this disease at an early stage so that we can try to reverse this disease. How can we diagnose this chronic kidney disease? CKD is common among, like if 100 patients have got chronic kidney disease, the commonest cause is diabetes. The next common cause is hypertension. Then another condition is called as chronic glomerulonephritis, around 15 to 20%, and another 5 to 10% are chronic interstitial nephritis. There may be around 10% about hereditary disease. In India, so we have at some pockets of in India, we have certain diseases we tell as chronic kidney disease of unknown origin, where they present very slowly, and they don't have any of the risk factors, and they usually don't have symptoms, and by the time we diagnose them, they're already in the later stages. So we see them in parts of Andhra Pradesh and also in parts of Karnataka and in North India. So, so if you have any of these risk factors like diabetes or hypertension, so we need to do 2 simple tests to diagnose this kidney disease. So what are these simple tests? One is to do a urine routine examination to see whether there is any proteins or albumin in the urine. Sometimes you may have a urine routine which is normal, so you can do an additional test called as urine albumin creatinine ratio, or urine for microalbuminuria. That is what we used to call earlier. Now we we tell it as only urine albumin creatinine ratio. If the albumin creatine ratio is more than 30 milligram, we tell that they have got a significant proteinuria or moderately increased albuminuria. So other test is to do a test called as serum creatinine. So and by this, if it is elevated, we can know that the patient is having CKD. So all diabetic patients, so irrespective of whether it is newly diagnosed or they are already diabetic for 5 years, if everyone does a two simple tests like urine protein and serum creatinine, we can detect this kidney disease very early in their life actually. And if we diagnose at a stage of just increased albuminuria with a normal creatinine, this is a stage we have very wonderful drugs now for diabetes, and where we can give these drugs and we can reverse at this stage. But once the creatine starts increasing, this disease is a progressive disease. What we can do is only slow down the progression rather than reversing this disease. So, I would suggest that all diabetic patients, all hypertensive patients, and all those who have got a family history of kidney disease, or all those who are older than 60 years of age, so we can do the screen ourselves to see whether we are suffering from CKD by doing a urine routine examination and a serum creatinine test. So, lastly, how can we prevent this kidney disease? The kidney disease prevention is at three levels actually. We tell it is a primary prevention, secondary prevention, and tertiary prevention. Primary prevention is at a stage where they are still not diabetics, hypertensive, and this is a stage where a common people can practice so that they can prevent kidney disease. So I will tell around 9 golden rules. What we can do is, one is you have to keep yourself healthy and fit. So we have to regularly exercise, keep our body weight in check. That is the first thing. Second thing is you have to eat a healthy diet actually. So healthy diet means see that you not eat everything whatever it is there. So you need to drink a lot of water, and you need to drink you eat a lot of fruits and vegetables. So coming to drinking water, we need to drink at least 8 cups of water per day. And the fourth thing is, we can, if you are a diabetic or an hypertensive, you have to see your blood pressures are less than 130/80. The guidelines keep changing. The current guideline says that if you are a diabetic, you need to keep your blood pressure less than 130/80, and if you are hypertensive up to 130/85 is still okay. But if you have proteins in the urine, you need to keep less than 130/80, and avoid taking over-the-counter medications. So it is a habit for us. If we have a headache or a body, you directly go to a medical shop and ask for a medication to relieve your pain. So commonly you end up taking non-steroidal anti-inflammatory drugs, we tell NSAIDs, and these are the drugs which may cause kidney damage. And lastly, so if at all you have any of the risk factors of diabetes, hypertension, you need to regularly or periodically screen yourself. If you are a diabetic, every year screening is better to know you have some form of kidney diseases. Secondary prevention is a stage where already you have got chronic kidney disease, and whatever you are trying to slow down this disease. So for this, you need to consult a specialist, especially who is trained in nephrology, so that you meet him at an early stage of chronic kidney disease. So he will advise you a diet, and he will give you medications not only to slow down the chronic kidney disease but also to prevent the complications of chronic kidney disease. So by this, I would like to conclude telling kidney disease, CKD, is common. So it is becoming the biggest burden to the humanity. The cost of the treatment is very high. When they reach end stage kidney disease, the only options are dialysis and transplantation. The only way we can tackle this disease is to see for primary prevention. So, and if at all you have any of the risk factors of CKD, you need to screen yourself and detect this disease very early in life so that you can tackle at that point. So thank you once again. I am Dr. Anil Kumar B.T. I'm a consultant nephrologist and transplant physician working at BGS Hospital. Thank you.